soo dhawow madaxweynaheena oo soo dhawow madaxweynaheena oo soo dhawow madaxweynaheena oo soo dhawow shacabku ku salaamaya sadiqay ha ku ilaaliye shacabku ku salaamaya sadiqay ha ku ilaaliye سعد القرحانيو سناني عدالة بان سعد القرحانيو سناني عدالة بان أنا وذا سوغيناي سليقا قوى شرفي سهانكا قوى قولي سعدالكا قوى نبضي
وزيري CS Health, my sister Susan Fuller. Let me take this opportunity kukukaribisha sana Garissa. Karibu, na hakika kidogo tumesema kwamba you are in a hurry to go back, lakini Garissa waziri has a lot for you to see, including some tourism activities. Hapa sisi kama kimila, when we have a very good visitor, we normally allow them to stay, tuwachinjie ngamia, but you are in a hurry. Leo tutakusamehe, lakini next time you will come so you can stay with us. Waziri karibu, and as was said ahead of me by my colleagues, we are not taking it for granted kwamba ulipata fursa ya hii leo ya Cancer Day, World Cancer Day, na ukasema kwamba I will do it in Garissa or I will celebrate in Garissa. We are not taking it for granted. Kwa hivyo kwanza kabisa, mine is to really thank you, to appreciate you and your team. You are a very able team, including my friend Dr. Mulwa, who has always been in the forefront in terms of issues Garissa. Waziri, what I want to tell you is that the opportunity of launching also this great facility today, you have seen also the kind of team that we have put together, of course with your help. You have seen that we have some staff from the national government, but we all have also put together a very strong team. Kwanza mimi ningependa waziri, the team that you saw this morning, they need also to be appreciated. Vijana wetu, our doctors, our ladies who are attending to this facility, I want to take this opportunity in the presence of CS Health, ili niwaambie mubarikiwe. I will wish you all the best. You are doing a great job. Waziri, that you have come to us on this important day is not mambo ambayo tunachukulia kirahisi. As I told you, we really appreciate and we hope your coming to us today will be the beginning of a great journey as we now highlight the opening or the launching of this facility, ili watu wa Garissa, watu wa Northern Kenya region wafaidike zaidi. I want to tell you that during my first tenure as the governor of Garissa County 2013-2017, we did a lot. We did a lot in healthcare sector, including actually some real history making. We created theaters in some of the remotest parts of this county where, we had operations or surgeries being done for the first time in the history of this country. We had some of the best referral activities. We had a large number of community health workers who are serving in the remotest parts of our county. Waziri, tumefika mbali at that time mpaka we were recognized for a number of areas being the top in the country, and we were even awarded by your former predecessor, Dr. Cleophas Mailu. Alitupatia zawadi akasema, Garissa County, you are doing very well in healthcare. What I want to tell you today is that I'm back, and with this kind of facility in our midst, hopefully we'll also make gains together, you at the helm also of the Ministry of Health. Kwa mimi yangu ni kukaribisha na kusema kwamba we are having big plans. You'll be hearing about healthcare in Garissa. Very, very soon we'll be launching, or rather we'll be laying the foundation stone for one of the biggest facilities in the country. That is Mother and Child Hospital in Garissa here, which already is fully budgeted for in our budget for this year. Karibuni sana tutaanzilisha huo mradi, ili pia we have another milestone to talk about in Garissa County as far as healthcare is concerned. So we look forward to working with you, Waziri. We look forward to seeing more of these collaborative activities together, so that we can actually serve, as you rightly said earlier, we are serving the same people, whether it is the county government, whether it's the national government. These are our people, and we are serving them together. So let's work together for the betterment of our people in terms of healthcare. I will have taken a bit of time to discuss with you some of the key health indicators in our county, but I will leave that for maybe once I come and see you in your office. And now let me take this opportunity, a great pleasure, to welcome you to talk to your people in Garissa.
Excellency Governor Nadif Adan Jama, my friend, Member of Parliament, Honorable Adan Wajir South, County Commissioner, Garissa County, members of the county government of Garissa present, my colleague officials from the national government, representative from the communities, civil society organization, from the support groups and other private sector, members of the press, na wananchi wa Garissa. Salamu alaikum. Sisikii mkijibu salamu alaikum. Penye natoka tunafanyiana hivi, na huku mnafanya namna hiyo. Asante sana. Governor, let me first start by congratulating you on your re-election. Getting elected is not easy, and getting re-elected is even much harder. Congratulations, Governor. It gives me great pleasure to join you today to launch Garissa Regional Cancer Center. And this is the first in Northern Kenya region since independence. This is the third such facility that we have unveiled in the country in the last 1 year, which is a significant milestone in the history of our nation. This indeed resonates with the theme for World Cancer Day in closing the gap in the care of cancer. Ladies and gentlemen, NCDs, including cancer, are the leading causes of illness and death globally. This results in estimated 41 million deaths annually, with about 10 million, which is 25%, attributed to cancer alone. The burden of cancer is rising over the past few decades, and it's projected to get even higher, as we were told by our chief, the executive director of this hospital. The most recent data that I have seen in my ministry, it shows that of 7,502 cases that were registered from 42 facilities across the country between July 2021 and June 2022, with most of them being stage 3 and 4. The most prevalent cancers continue to be breast cancer at 15.9%, cervical cancer at 13.3%, and esophageal at 11.8%. Prostate cancer accounts for a quarter of all cases among our men, with breast and cervical cancer accounting for more than half of the cases among our women. Close to 3/4 of all cases among our women, these are cervical cancer. Here in Garissa, we mostly see cancers of the head and neck, and I am concerned that they presenting very late to our facilities. I know that we can change this experience. And I listened to the CEC for Health on what he did in creating awareness in the local language. I've also listened to the Member of Parliament, and I want to congratulate them and say, let us continue creating our awareness so that our people can get treatment. The heavy impact of cancer on individuals, households, and entire communities through loss of productivity, catastrophic costs of care, premature death is well known to most, if not all of us. Barriers and inequalities that exist include misinformation, stigma, inadequate infrastructure, untrained personnel, and lack of equipment. These have led to unfortunate situation we find ourselves in, whereby most cancer patients, even where they are within the healthcare system, are diagnosed at late stages, resulting in poor treatment outcomes and lower survival rates. But as we stand here today to celebrate, that needs not to be the case, because now we have a facility ambayo itawahudumia ninyi wananchi. Ladies and gentlemen, my ministry has prioritized transformation of the health sector by addressing issues around access, around cost of quality health, and we are going to do this through universal health coverage. Last December, for example, here in Garissa, we trained more than 20 healthcare workers on cervical cancer and breast cancer screening through support from the Global Fund, and also provided pap smear kits for screening. Further to this, the ministry established the regional cancer centers, one which we are launching here today in other places within the country. We have several that were read out to you. We continue to provide with basic chemotherapy medicine through KEMSA, and last month we also came and launched the depot here to take care of your supplies. As I conclude, ladies and gentlemen, I wish to make a call to action to all of us today. Among the leading cancers in Kenya are cancers that can be prevented through screening and early diagnosis. This includes cervical cancer, breast cancer, and colon cancer. As it has been said, prevention is better than cure. And that is why a big part of our focus as a ministry is on preventive interventions.